Hello, my name is Dr. Shah and I'm a board-certified internist with 25 years of experience who finds himself currently on the front lines of this pandemic, COVID-19. And while I want to emphasize that the backbone of our response to this pandemic remains social isolation and aggressive testing, many of my patients have asked me, while they're in social isolation, are there other things that they can do to reduce their likelihood of being infected with the virus responsible for COVID-19? And my answer is absolutely. So in this video, I'm going to give you 5 recommendations that are simple to apply that may reduce your likelihood of infection. The very first recommendation is a cool mist humidifier by your bedside at night. Why? Because cool mist humidifiers generate a tremendous amount of humidity, and humidity moisturizes our upper airway membranes, and moist mucous membranes reduce the likelihood of infection by a virus like the one that causes COVID-19. My second recommendation is the next morning, engage yourself in a long, hot, steamy shower. Why? Because that steam will help percolate and also open up and loosen secretions that might have developed overnight. And then take a little bit of warm water and apply it to each nair. And while you're holding the other nair closed, blow out whatever secretions you've accumulated overnight. A simple mechanical way to reduce the likelihood of viruses hanging around in our nairs. My third recommendation is that if you're on any kind of a sedative, that includes benzodiazepines, opioids, and even antihistamines, now may be the time to consider not taking them. Why? Because in order for this virus to become much more serious and pathologic, it has to end up in our lungs. And the mechanism that it's using to get there is aspiration. So what happens is that it sits in the upper airway where it causes a lot of secretions to be produced, and then it's hoping that at some point you'll aspirate. And what is aspiration? That's when some of our oral secretions or even food particles go down the wrong tube. Instead of going down the esophagus, they end up going down the trachea into our lungs, and that's where they can cause serious problems. And sedatives increase our risk of aspiration. Along the same lines, if you have an upper airway infection and you haven't been able to get tested because perhaps tests are not available, then this may be the time to consider sleeping either with multiple pillows propped up behind you or on a recliner. Why? Because as we become more upright instead of horizontal, our likelihood of aspiration decreases. And finally, my fifth recommendation is something that involves what we call the marginal pool. Now, what you may not know is that our immune system is divided up between an active component that's in our bloodstream and a marginal pool, or what I like to think of as a reserve component, just like our Army Reserve or our National Guard. And that marginal pool lives in something called the lymphatics. So how do we get this marginal pool out of the lymphatics and into the bloodstream where it can actually help us? Well, that's where vigorous exercise comes in. So whether you want to do aerobic exercise or you want to work out with weights, it doesn't matter, because either way, your lymphatics will get activated and all that marginal pool will get squeezed out into your bloodstream, making you have the best possible immune system, hopefully to protect you from COVID-19.